Have you ever wondered about the different components of blood and when each type is used in a transfusion? Blood, that life-sustaining fluid coursing through our veins, is not as simple as it might seem. It's a complex mix of various components, each playing a crucial role in our body's function. Let's break it down. First, we have the red blood cells, or erythrocytes, the tiny oxygen carriers that give blood its characteristic red color. These are typically transfused in cases of anemia or blood loss. Next, we have platelets, the body's first responders when it comes to wound healing. They clump together to form clots and prevent bleeding. In transfusions, they're often used for patients with low platelet counts or clotting disorders. Lastly, we have plasma, the liquid gold of the blood. It's the watery substance that carries cells, nutrients, hormones, and more. In transfusions, plasma is used to treat patients with liver disease, severe burns, or clotting problems. Now that you have a better understanding of blood components, let's move on to the next step of the process. Before diving into the transfusion process, it is crucial to perform a pre-transfusion assessment. This assessment is akin to laying the groundwork for a safe and effective blood transfusion. Firstly, we conduct vital checks. These include measuring the patient's temperature, pulse, blood pressure, and respiratory rate. We also monitor for any signs of discomfort or anxiety, as these could be early indicators of potential complications. Next, we delve into the patient's history. This isn't a quick glance at their chart, but a comprehensive review. We need to know about any past transfusions, allergic reactions, or blood disorders. Don't forget to check for any religious or personal beliefs that might affect the transfusion process. Lastly, we turn to compatibility testing procedures. This is where we match the patient's blood type with the donor's. We have 4 main blood types, AB, AB, and O, each with its own positive or negative Rh factor. Compatibility here is key, as a mismatch can lead to serious, even fatal reactions. Remember, every patient is unique. Their vitals, history, and blood type provide a personalized blueprint for the transfusion. This process might seem time-consuming, but it's time well spent. It's about ensuring safety, minimizing risks, and ultimately saving lives. A thorough pre-transfusion assessment can ensure a smooth and safe transfusion process. So let's always take the time to get it right. After all, in our line of work, accuracy is not just important, it's a matter of life and death. Handling blood safely is a critical aspect of the transfusion process. Let's break it down into 3 key areas: storage, transportation, and preparation. First up, storage. Blood products must be stored at appropriate temperatures to maintain their viability. For instance, red blood cells should be kept between 1 and 6 degrees Celsius, while platelets prefer room temperature. Then comes transportation. Blood products have to be transported in temperature-controlled containers to ensure their quality isn't compromised. It's crucial to uphold the cold chain process during transit. Finally, we have preparation. Before administering, blood products need to be checked thoroughly. Make sure the blood type matches the recipient's, the product is within its expiry date, and there are no signs of contamination or damage. Remember, the goal is to ensure the safety and efficacy of the transfusion. Being meticulous in blood handling can significantly reduce the risk of complications. Now we will walk you through the actual transfusion process. Kickstarting the procedure, we start by setting up the intravenous or IV system. The first step is to ensure that the patient has a functioning IV access. This is usually a peripheral or central venous catheter. Next, we attach a blood administration set, which is a special tubing designed to filter out any clots or debris. We then prime the tubing with normal saline to ensure that the blood doesn't clot in the tubing. Once that's done, it's time to initiate the transfusion. But before we do that, we need to double-check the patient's identity, blood type, and the blood product. It's crucial to have 2 registered nurses present during this step to cross-check all the details. This is to prevent any transfusion reactions due to errors. After all checks are complete, we can start the transfusion. Initially, we run the blood slowly, at about 2 milliliters per minute, and closely monitor the patient for any signs of a reaction. This is because if a reaction is going to occur, it's most likely to happen within the first 15 minutes. During this time, we keep a close eye on our patient, looking for any signs of discomfort, such as chills, hives, chest pain, or difficulty breathing. We also monitor vital signs, including temperature, pulse, blood pressure, and respiratory rate, at regular intervals. If all is well after the first 15 minutes, we can gradually increase the rate of the blood transfusion while still monitoring the patient closely. It's important to note that a blood transfusion is not a race against time. The blood should be transfused at a rate that is comfortable for the patient, and the entire process can take anywhere from 1 to 4 hours, depending on the volume of blood being transfused. All through this process, the patient's well-being is our top priority. We always want to ensure they are comfortable and free from any adverse reactions. Remember, careful monitoring during the transfusion is key to identifying and managing potential reactions early. Even with all the precautions, complications can arise during a blood transfusion. The most common reactions include fevers, chills, and allergic responses, which can be as mild as a rash or as severe as an anaphylactic shock. Hemolytic reactions, though rare, are serious and can occur when the recipient's immune system attacks the transfused blood cells. To identify these reactions, constant monitoring of the patient is vital. Keep a keen eye on any changes in vital signs and always be alert for signs of discomfort or distress. Should a reaction occur, stop the transfusion immediately and initiate supportive care. In the case of an anaphylactic reaction, you'll need to administer epinephrine promptly. For a hemolytic reaction, the response should include maintaining renal perfusion and treating any resulting complications. Remember, the key to managing complications is staying vigilant. Quick identification and management of reactions can prevent serious consequences. Documentation is a crucial step in the transfusion process that should not be overlooked. It's the invisible safety net that upholds the entire process and protects both the patient and you, the healthcare professional. Let's start with the basics. Every detail of the transfusion, from the pre-transfusion checks to the patient's reaction post-transfusion, needs to be meticulously noted. This includes the type of blood product used, the batch number, the date, and the time the transfusion started and ended. Equally important is documenting the patient's vital signs both before and after the transfusion, and any reactions they may have had during the process. The more detailed and accurate your notes, the better equipped you are to provide the best possible care for your patient. Now, let's talk about best practices. First and foremost, always double-check the patient's identity before initiating the transfusion. This simple step can prevent potentially fatal mistakes. Another best practice is to monitor the patient closely during the first 15 minutes of the transfusion, as this is when most reactions occur. Lastly, remember to always use a new blood administration set for each unit of blood or blood component transfused. This not only prevents complications, but also ensures the accuracy of your documentation. Proper documentation and adherence to best practices can ensure the safety of the patient and protect you as a healthcare professional. So let's make every effort to follow these guidelines and continue to provide the best possible care for our patients.